Hi, I'm Linnea Julian. I'm the Administrative Director of Surgical Services here at Menorah Medical Center.
I'm Tiffany Purdue. I'm the Clinical Nurse Educator for Surgical Services.
My name is Tarek Khalil, Robotic Team Lead, Scrub Tech.
Nancy Pippert. I'm an RN. I work here in pre-op surgery.
I'm Tamara Stevenson. I'm the Surgical Liaison here at Menorah. I work with volunteers and we work at keeping the family members updated on where their loved one is in surgery.
This is my 30th year of nursing, and I have spent all 30 years in the operating room. How I got there is I received my bachelor's Science of Nursing from Graceland University. Coming out of nursing school, I actually found my job in the classifieds, and which many people don't know what that is anymore. But St. Joseph, Missouri had the opportunity to take graduate nurses, and they were going to start a program 30 years ago to train you to be an operating room nurse. So I was very fortunate to be selected. I then had the opportunity to, I was approached about a new position that the operating room was going to have at North Kansas City Hospital. That was going to be a board runner. So they asked me to run the board, loved it, still to this day my favorite job in the operating room. So I ran the board, and then my leadership started kind of evolving at that time. I never thought I would be a leader or want to be a leader, but I was approached for every one of my positions. And then next was supervisor of the operating room, which brought different tasks. I was in charge of staffing the operating rooms, making sure that the cases were running smoothly, that the day went the best that it could, and also that we had phenomenal patient outcomes, that it was really my responsibility to oversee all those opportunities throughout the day. Then I went to HCA and joined them as a director of an outpatient surgery center. And then ultimately was approached again to see if I would like to come to Menorah Medical Center to be the director there.
I started at the University of Central Missouri and got a bachelor's in education. From there, I worked in a preschool, did the education role, and then I got a job at a hospital working closely with nurses. From there, that's when I decided I wanted to be a nurse for the fact of the variety of nursing roles you can hold. And so from there, I went back to nursing school as my second career, got my degree from Research College of Nursing. From there, I knew that regular bedside nursing wasn't for me, so I took the non-traditional role in a sense and went straight as a new grad to the operating room. Loved it, did that for about a year, and then was approached to become an educator or think of the idea of being an educator, and I accepted the role here at Menorah as an educator.
I went off to college, four-year university, didn't know what I wanted to do. Did 2 years at the four-year university in Springfield at SMSU. And then my college roommate was going into the Navy, and they had actually asked her, put her on that pathway of nursing school the Navy was going to pay for. So that intrigued me. And then my sister at the time was a nurse as well. So that encouraged me. So I went into nursing. They did not have a program there at the college, a 4 year. So I did 2 years of my prerequisites there, moved here, married my husband, and went to Johnson County Community College. They have a ADN program there, and did the program there, which was an excellent nursing program.
So started my career back almost 23 years ago in Tulsa, Oklahoma, St. Francis Hospital. Worked there for about 8 years. Then I went into the scrub tech role.
That is our department. It's all about teamwork. We work together with the anesthesiologists, the OR nurses, the techs, all together. If one part's missing, it'll mess up the whole process. So from start to finish, when a patient is reached out to from that team and that nursing department that calls the patient and gets all the history and information, they can collaborate together so the doctors can look at the patient's history to make the surgery the safest possible for them. And then when we all come together on the day of surgery, getting the patient ready in a timely manner, keeping them safe to get them through to the end of their process of their surgery. We worked really well as a team. It's a fast-paced area, but it's a great area to work in. I mean, it's all about teamwork. If one part of the team's missing, someone is there to pick up that slack, but it's better when we're all working together on it. So.
And it's the team that defines how good the program is, how successful the scrub tech is, and the circulator, and the doctor. And if it wasn't for the doctor, we would not have this program. If it wasn't for the patient following the doctor's lead, letting them know, hey, come to Menorah because we have one of the best robotic programs in the country, we would not have this program. So it encompasses the whole team, from a scrub tech to a nurse to the physician and our CRNA.
I think what I look for in someone that has potential to move into leadership or into that role is really the concept of teamwork and how they handle themselves in a team. Whether that's you're working with your patient and now you've formed this alliance and you two have the same common goal as a team, how do you lead that patient through that? Or how do you take your colleagues and engage them on a case, or how we rearrange something in the operating room, or learning a specialty that you maybe didn't know before. I look for people that really engage themselves, speak up, communication style, very transparent.
Teamwork's the only way we can get our job done, because I can't be in pre-op, recovery, and the OR at the same time to get updates on family members. So the teamwork of having them contact me and communicate, tell me where we're at, makes my job possible.
Highly, highly important. You got to have the communication. If you don't have the communication there, it's not going to be successful. So just in the process of getting a patient ready for surgery, if one starts out and you're missing a piece of information, you got to ask for, go further, ask somebody else, hey, can you help me? Do you know a little bit about this? What can I do to help you in the process to make this successful for the patient? So communication with one another is so important to carry on to the next level, next phase of the recovery for that patient. So you got to have that.
Always being open-minded that just because that's the way we've done it, or I even think that it needs to be done that way, being open-minded to hearing others just opens up the opportunity for everyone to always be learning, always being able to focus on wanting to do the best and moving forward with everything that we do.
What makes my day so great, and I look forward to coming to work every day as I have for the past 25 years working at Menorah, the people I work with, they care for one another, we communicate, we work so well as a team. That's what this is about. You got to have the people or it's going to fail. You can have technology, all the highest tech in the world, but if you don't have that extra caring soul to take care of that patient that's there and scared and hurting, it'll fail every time. So you got to have the people. That's what it's about.
I work really closely with the new grads, the newer nurses, even people who have a little bit of experience, and seeing them grow in their profession and also grow within our department and the relationships that we have here.
What I like about this career at Menorah Medical Center, especially in surgery, is the teamwork, the team environment. Our wonderful surgeons that continuously bring our patients back to Menorah. And I can't overemphasize that enough. We have a good group of leadership, and we have a good group of leadership from an administration level that backs the program. And I believe that's why we've been so successful.
I love interacting with the public. I'm an OR nurse, so it's nice to have awake people to interact with for a change, and to make sure people on one of their scariest days are a little more calm.
Listen to your patients, not just your patients, but your team too. But if you just lend an ear and listen to what they're saying, what's going on in their lives, what can I do to make their day better, to be more successful, and to come out happier and healthier from that day forward. So just listen to your patients, listen to your teammates, be there for them, be supportive, and just be happy. Show that smile, do the best that you can to just care, and it'll come through, and you'll hear about it too.
People do make mistakes. People maybe don't engage themselves how they want to, but owning that immediately, being able to speak up and advocate, is a big one. But communication style is probably the biggest thing. Not afraid to engage themselves in conversation, talk to all levels. As in the operating room, we work with people at all levels of education. And so it's very important that you treat pretty much everyone the same and engage yourself in conversation.